Good morning, everyone, and welcome to the Thursday, August 19th, 2021 Joint Board of Health and Hospitals meeting. And first agenda item, I would like to call this meeting to order, please. And we would like to go through the approval of the Zoom video that serves as the minutes from the July 15th, 2021 Board of Health meeting. May I please have a motion to approve those minutes?
So moved.
Second, please. All right, I saw Dr.
Second.
Second, thank you. Any opposed? Or is everybody, can we vote on accepting the minutes? Anyone opposed?
Aye.
Thank you. All right, the minutes are accepted, and now we can move through the rest of the agenda. So our first agenda item is the COVID-19 update by Dr. Eccles.
I have a brief slide set that I'll share this morning, so I'm going to share my screen. Maybe y'all can let me know if you can see my screen.
Yes.
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 So based on the information that we've collected over the last month and for the last 2 weeks, what we're seeing across the city of St. Louis is that there continues to be transmission of SARS-CoV-2 across all segments of the city of St. Louis. However, we have identified some hotspots over the last month, being in the southern part of the city, in neighborhoods 16, 17, 3 and 1, 19, 61 and 36. And then over the last 2 weeks, we continue to see activity in those areas. So we're working to make sure that we're getting communication and information out to those areas, but also other areas of the city, so people can continue to implement the measures, or be reminded to implement the measures that they need to conduct to protect themselves, or at least reduce their risk of being exposed to SARS-CoV-2 and subsequently becoming affected. One moment. I want to look at the cases by race. So African Americans continue to account for over 70% of the COVID-19 cases. And so this is a message that we're trying to get out to the community, because we know that African Americans are continuing to lag behind as it relates to vaccine uptake. So we have a very implementing a data-driven approach to reach those segments of our population that continue to have low confidence in the vaccine, or remain hesitant to receive a vaccine. And what we found to be helpful is having small town halls before vaccination events. So we've held one with the Marriott team with their frontline staff. We have a few more with other corporate organizations who have roughly about 50% of their workforce vaccinated. So the goal is to make sure we're hearing their concerns, answering any questions they have, and also dispelling any misinformation that they may be hearing in the community. We look at the reproductive number. Overall, the reproductive number is going down. At this point in time, the transmission, at least the highest reproductive numbers amongst those who are age 0 to 19. That's also evident in what we're seeing in cases. So at this point in time, individuals who are 0 to 10 years of age are accounting for a greater percent of the COVID-19 cases in the city of St. Louis, and those who are 0 to 19 are accounting for about 30% of COVID-19 cases in the city of St. Louis. And that's really concerning for us, because we know that individuals less than the age of 12, younger than the age of 12, remain ineligible to receive a COVID-19 vaccine. So we're working with our academic partners, particularly primary and secondary schools, to get information out to parents. And we also continue our messaging on our social media platforms to remind parents and guardians of their roles and responsibilities as it relates to protecting the health of their family, and particularly children who remain ineligible to receive a COVID-19 vaccine. And we're also starting to work more closely with youth-based organizations such as the Story Stitchers. So we've partnered with them for a couple of events, which have been pretty beneficial. We've held Q&A sessions, hearing their questions and concerns. And interesting enough, after providing answers and listening to their concerns. Many of them, or some of them, actually opted to get vaccinated because they were, prior to the event, what they were holding on to was misinformation that was being shared among people in their circle. And so we also reminded them, that of their sphere of influence. So, making sure that they have accurate information in the event, that they are providing information about COVID-19 or COVID-19 vaccines to individuals who trust them. We also had a listening session with the Herbert Hoover Boys and Girls Club. Most of the participants were younger than the age of 12. Many of them have a good understanding of what quarantine is and what the mitigation measures are. But they also had were asked some questions about the history, or asked questions about why masks were being required for schools and so forth. So we were able to have a really good dialogue with about 7 of their youth in their program. And we're hoping that information was taped, and so we're hoping to get that information out over the upcoming weeks. We look at the reproductive number by race. So African Americans and Caucasians, the reproductive numbers is dropped below 1, which is promising. But we still remain on edge because we know that that can change at any time, and so we continue to issue information to the community, reminding them of the importance of continuing to implement the mitigation measures and get vaccinated. The vaccination rate is inching towards herd immunity. At this point, we're roughly 51.3% of the population has initiated the COVID-19 vaccination process, and a little over 43% have completed the vaccination process. So there's still ways to go. One concern that we have is, with the recommendation for the boosters, more than likely we'll have larger groups coming to or desiring to get vaccinated. And so we'll have a discussion probably with some of the larger venues to schedule a time to towards the mid to late September to start holding more larger vaccination clinics, because we'll have a larger segment of the population who will be coming. We have those who will need to receive their first or their initial dose. We also have those that will be coming to receive their booster dose. We'll continue to work with our federally qualified health centers and other community partners that serve as vaccination sites, so people will know that there are multiple access points across the city of St. Louis where they can go to receive COVID-19 vaccines. In the city of St. Louis, particularly for the health department, on yesterday, a message went out from the mayor's office and Department of Personnel regarding vaccination certification. So in these, for all city employees in the city of St. Louis, they are required to complete a vaccination certification form by October 15th. All individuals who are fully vaccinated will be a part of the incentive program, and those who are not fully vaccinated will have to submit to weekly testing. And so that will require the health department working with our partners to provide COVID-19 testing on a weekly basis for those who are not fully vaccinated and those who are unvaccinated. The first week of testing will start on the week of October 22nd. When we look at the breakout, the zip codes of the lowest vaccine uptake remain in the northern part of the city. So we're working with more community-based organizations to reach individuals in those communities to answer their questions. And also the emergency preparedness program with the city of St. Louis is working with its partners to host vaccination clinics in those areas. And so this is an ongoing effort that will continue for some time. But beyond COVID-19, we're also working to make sure individuals have information about what medical resources and services they can access in the event that they don't have a primary care provider or a medical home, because that will be important beyond the COVID-19 pandemic. And so that's another initiative that the health department is implementing at this time as well. All right.
Thank you, Dr. Eccles. Do we have any questions, comments, or discussion?
have a question about I guess, switching back to the larger events with the expectation that folks who might need booster shots might drive up kind of the volume of folks who are getting vaccinated. If I'm understanding correctly, the booster shots are recommended for folks who are immunocompromised or may have underlying health conditions. And if I remember, when we were looking at that population before, we felt like the larger events weren't the best because sometimes they had longer lines to wait in. They weren't as, easy to access. So is there any thought around if you might do a smaller clinic or a smaller location for those booster shots, considering the population that would be accessing them?
Right, so the recommendation for those who are immunocompromised, that recommendation is already out. So those individuals can receive the vaccinations now. So right now we're still holding our smaller vaccination clinics and partnering with the FQHCs. But the larger events we're planning for when they recommended for all individuals, for the general population. And that'll be, the CDC is planning for the middle of September, so around September 20th is the date that they put in their notice, or the Department of Human Services put that in their the note that they released on yesterday. So right now, individuals who have conditions that suppress their immune system, they can go out to the smaller events to receive a COVID-19 vaccine and their booster dose. So you have another question?
No, it seems like you just stated what I was asking. If we would still have smaller events for folks who have underlying health conditions, because it sounded initially like we were going to try to hold a larger event, which didn't seem to be the most appropriate venue for those folks before. So, but you answered it, so that's helpful. Thanks.
Dr. Eccles, I have a question. This is Tanya. Why do you think that some folks are getting the initial vaccination and not going back to the second vaccination?
So part of that, I think, is due to the information that was circulating in the media as well. So some of the evidence, particularly around for the second dose for the Pfizer vaccine amongst younger population, led to complications such as myocarditis, and I think they held on to that. And so then there's also misinformation that's circulating in the community as well. People are believing that they only need one dose. There was this event that happened over the weekend where that actually happened. It said they thought they heard on the news that only one dose is required. So we have to continue to do our due diligence to dispel the misinformation that's circulating and make sure people have an opportunity to ask any question they have before they actually receive the vaccine at our event. So there's several different factors, but misinformation is really at the top of the list as it relates to why people are not receiving the COVID-19 vaccine, and distrust for government and the health system.
Thank you.
Any other questions or comments? All right, we will move on to the next agenda item. And so we have an environmental health report by Dr. Eccles and Dr. Moshe.
So this is a project that has been underway for some time. The last environmental health report that was released by the health department was back in 2017. And so this is one of our critical programs. The Environmental Health Division is really the regulatory arm for the health department. So it's really important that individuals understand not only what the program activities that are happening, but how those program activities are influencing the health of our community. And so we are in the final stages of almost complete. The official report is almost complete. And so I'm having Dr. Moshe provide an update to the board so that you all have an idea of what information will be included in the report and when you can expect the final document. So at this time, I'll turn it over to Dr. Moshe. Dr. Moshe, you're on mute if you are.
Oh, sorry for that. Yeah, we're ready to present it, and my colleague, Rhonda, will present on my behalf. So Rhonda, please, you're welcome.
Okay,
Hi. Are you guys seeing my screen?
yes.
Okay. So this is the food and beverage control section. And this section primarily does complaints and inspections for all our food establishments. And we have summer food inspections, the temporary food establishments. And as you can see here, more than half, like 57% of the inspections are routine inspections of low, high, and medium risk establishments. And the one thing about this year is we have 24.1% of special inspections. This is quite a bit of an increase compared to previous years. It's like a 971% increase of special inspections. And those are primarily due to enforcement of health commissioner orders. And in this slide here, you can see the total inspections for 2020 did decrease, even though we had an increase in special inspections. This decrease was primarily due to our restaurants being shut down and our temporary establishment and events being closed down. We had our temporary permits decreased 85.7%. And you can see in the chart to the right how drastic of a decrease that was for 2020. This resulted in a decrease in revenue for us from normal of around 725,000 to 593,000 per year. And the total inspections for 2020 were decreased by 28%. Of the inspections, the top three critical violations are normally hand washing, wear washing, and time and temperature control. Food and beverage control had 372 complaints. It's slightly down from previous years, but it's kind of the trend is fairly consistent. One thing we did notice was a slight increase in confirmed violations for ill food worker complaints in 2020. In the community sanitation section, in that section, we do a lot of routine inspections of hotels, lodging, massage, tattoo parlors, swimming pools, childcare. We do some fumigations. And as you can see, those inspections have been declining consistently since 2017. And especially in 2020, there was the staffing there was pulled quite a bit to do other things due to the pandemic. In 2020, we did have a slightly increase in our complaints for the community sanitation section. The majority of the complaints were refuse-related complaints. That was 32.9%. As you can see in this map here, most of the community sanitation complaints are occurring in the southeastern part of the city and also up in the northern part of the city. In these two maps, we're showing the complaints that we received for roaches, mice, rats, and bed bugs. And these are interior complaints that we investigate. And on the left is a density map of those complaints. And on the right is a map of our asthma issues. So that kind of shows where our hotspots are for the interior indoor air problems. And then also it does somewhat match up with the areas of higher rates of asthma. Our refuge by ward complaints, refuge is kind of divided out by commercial dumpsters, hazardous waste, raw garbage, and tire. And this map shows that, again, we have more of the problem with the complaints in the southeastern part of the city and some up in the northern part. And this is our air pollution program. They primarily inspect for demolitions and asbestos. And they had a slight increase they had an increase in 2019. There was a huge construction project in 2019, which is the reason for that increase. And then there's a slight increase in 2020, and you can see it's a trend that's consistently the demolition projects are increasing, and they're increasing in this map primarily in the northern part of the city. So that's a little concerning. We want to keep an eye out in that area because of our asthma issues there. So it's a good thing that we have our inspectors. And of the complaints that we get in our air pollution program, they do get very few complaints, but of the complaints, they get some for asbestos, some for idling, some for open burning and fumes, smell and odor. And then some of the responses are issues of no response for the Department of Natural Resources. Their open burning complaints have increased slightly this past year. And we think that's primarily due to the increase in fire pits. People just like to use those socially outdoors. And animal control has had a decrease in complaints, and they have dropped down to 2,030 complaints compared to 2016, where we had 4,179 complaints. And if you look at the complaints by type, the highest 31% is primarily due to stray animals. And then we do have another high percent here where we're checking the welfare of the animal. Sometimes it's the dogs left out in the heat or the cold. That tends to be a lot of the complaints. We do get animal abuse complaints, and we track those separately, and that's about 5% of the complaints. Here, we've mapped the stray animal complaints, and we've also mapped our animal bites to see if there's a correlation. And you can see that on the southeastern part of the city, there are a lot of stray animal complaints, and also in the northern part of the city. And that tends to be also the areas that we've gotten a lot of bite complaints also. And then we have our vector control program, which primarily deals with rats and mosquito issues in our city. 52% of their complaints are regarding rats, and 35% are regarding mosquitoes, where they will go out and spray an area if there is if they detect there's a large amount of mosquitoes in that area. The vector control complaints decreased a lot in 2018, And that's primarily due to us transferring the workload to the other section in community sanitation so that they could do integrated pest management with their rat control and their refuge control. And you can see here in the map that it's kind of sporadic throughout the entire city, that we have some rat and mosquito issues, but we do have some hotspot areas in the north and where we get more complaints, and a little bit in Ward 24 on the south side. And that is we do have one more program in environmental health, and I'm not going to really touch on that one since Dr. Eccles has spoke quite a bit on our emergency preparedness program, but it has been doing a lot of work, and that's the other program in that area. Is there any questions?
Thank you, Rhonda. Maybe before we invite in the questions, I would like to emphasize that Environmental Health Service Bureau, this is one of the biggest bureau in our department, has about 9 programs. So what we presented is just a summary of a summary. We are still developing the report, and we are at the stage of summarizing some of the data, which actually, we shall, I think in the next meeting, we can also, be in a position to present some of the Bureau initiatives, in addressing some of the presented challenges. Another issue that I would like also to emphasize is that results of 2020 should be interpreted with caution, simply because, most of it has been affected by COVID. As you can see, there are less complaints, and less inspections conducted. All this was mainly due to the current pandemic. Thank you.
Well, thanks for that statement. I was going to ask a question about the food inspections and the action plan going forward. Have staffing issues been resolved? What are the limitations now and ramping up our food inspections?
So the staffing issues, although they have somewhat improved, they still impact the program's ability to comply with FDA standards. This year, the health department was granted 2 additional environmental health officers, food safety, food inspectors, and so that will help. That gives us additional capacity, but it's still not where we need to be based on the FDA standards. The same goes for our animal care and control program. So in the past, we only had six animal control officers, which is insufficient to really meet the needs of the community. So this year we were granted 3 additional animal control officers. So we're working to fill those positions. But ultimately, there's a lot of other core issues that need to be addressed and significant changes in order for the health department to perform in a manner that's compliant with national standards. So we'll continue to work with the mayor's office and the budget division and other city entities to make sure that we're properly advocating for ourselves, as well as the Board of Aldermen, to make sure they're aware of the impact of staffing issues, the impact that staffing issues continues to have on the department's ability to meet the needs of the community.
Thank you.
Do we have any other questions or discussion items? So Dr. Moshe and Rhonda, my namesake, thank you for the report and providing us that information. So we can move on to committee reports. Governance and Nominating Committee.
Good morning. So as you may remember, the Governance and Nominations Committee had been working on revising portions of our charter. We are still described in the city charter as the Joint Board of Health and Hospitals, and of course we no longer oversee city hospitals. So we're still working with the new staff at the mayor's office to work through some of those changes. And we I think the mayor's indicated some willingness to work with us, but we're not on a fast track list of priorities at this point. We will convene, I think, in September to start thinking about whether we will have any board vacancies to fill. At this point, we will not have a long list of board vacancies, maybe one slot. At most, we're still in the process of reaching out to those people whose terms might be coming up in the next year. Thank you.
Any questions or comments? All right, Craig, Academic Public Health Collaborations Committee.
Good morning and thank you. Yes, a reminder, and I don't know when this invitation will go out, but there is the first conference for the Academic Health Department, which will be on October 13th, 14th, and 15th. I believe, we've talked about saving that date for the mornings. And so hopefully we will be getting that out as well. There is one of the latest things that we're working on is putting out for an academic research project around violence. And these issues came from the Violence Prevention Commission, which is our action team part of our Community Health Improvement Plan. So doing some research on best practices with regard to law enforcement wellness and mental health checks. There was some legislation this past session in Jefferson City that suggested when there are extra traumatic events, because for an officer in the city, virtually every day probably has some sort of trauma-laden aspect to it. But in those instances of high trauma, and then I believe once every 3 to 5 years, they indicated there should be some checks with officers for their wellness. It is the belief of the Violence Prevention Commission and others that that is not sufficient, and that impacts the wellness, obviously, of our officers, as well as their ability to function with the community, and has detrimental effects on violence in our city as well. Also looking at potentially looking at the COPS program, which is a community-oriented policing, and whether there are some best practices there. We're not exactly sure where we're going to land on all of this, but we believe that it would be helpful for us to have some research and data to be able to do either within the police department itself or within city government, some policy changes that would look toward trying to achieve some of these areas based on data and evidence. So that's where we are currently. Also, I wanted to add that there is some look at workforce development. That's one of the reports, and I know that Dr. Eccles has been looking at that for a while. There may be some ability based on the funding for us to do some work in that area as well as we move forward toward the 2023 reaccreditation. Thank you.
Thank you, Craig. Any questions? All right. The Health Communications Committee.
We didn't meet, but we sent to the members the final draft of the resident survey that we're going to launch in September, if I'm correct, to get residents' input into several other wellness areas that the department can communicate on in the next year, besides respiratory illness and responsible pet ownership. We're also testing the awareness of Be Well as our tag and some alternative ones, and looking at what experience people have with some of our wellness areas. So we sent the survey out after with its revisions, and then also asked the committee members to review a video about class CLAS guidelines and communicating equitably to all citizens about health issues. We didn't get any feedback on anything, so we assume that it's all great. But Harold can maybe explain a little more articulately, or Dr. Eccles, about what CLAS is, and also what else we've been doing in the communications area.
Yep.
So, go ahead, Errol.
Okay, Lisa, yeah, I'll try to chime in on what class means. And the board has already kind of talked about this in previous meeting.
Okay.
This is the culturally linguistic and appropriate services issue that we've talked about previously. And Dr. Eccles recorded a video kind of breaking down the meaning of what class means in layman's terms, so people will understand it. And we're hoping to share that with the community. We pushed it out to the communications committee to try to get feedback to see if it did meet the needs that we thought for the community. So since we didn't get anything, we're going to work on pushing it out.
We also have a meeting scheduled, Rhonda, I'm not sure, is it the 14th or 16th of September with the alders on the Health and Human Services Committee to talk about, we're going to ask for their help in distributing the survey and getting people in their wards to participate so we can get more grassroots response. But also to give them the 14th, give them some updates also on what we've been doing. Is that correct? And get their input?
Some updates. And I know we discussed, in addition to just distributing a questionnaire or, getting kind of that closed-ended questionnaire type of data, to have the alders to assemble some type of focus groups or more in-depth interviews to kind of triangulate the information that we receive from the questionnaire. So that's what we are going to be pitching at the board meeting, to get the alders to get their wards involved and their citizens.
I have a quick question about the communications firm that we had been contracting with. I know I'm having a block. The young lady who was over that left that firm. What's the status of that relationship with the health department now?
So we had a meeting with them. So we looked at the performance of the services over the last year, and there was some, they did a wonderful job. There were some specific needs of the community that weren't necessarily met. And so we had to communicate with them towards the end of their contract term. And now our focus is working with the communication division in the city of St. Louis, so STLTV. So they have subject matter experts that they can tap into to help drive and oversee some of the projects that we need to implement on the communication front. So right now we've executed a agency agreement between the health department and the utilities division of the city of St. Louis. And that's where we are right now. But the projects that they did start, we were able to complete those, or some of them are actually still in progress, such as the Humans of St. Louis project, which is being shared on social media.
Thanks, Fred.
I had a quick question about the survey. So in my first question is the survey something that would be sent out to all city residents, or will you be doing this in focus groups or designated segments of the population? And my second question is how you will define those health areas in which you're seeking information. Will you just ask city residents broad questions about health areas in which they're interested, or will you give them different areas to choose from to select their interest? And part of the reason I asked that question is, I'm mindful of the fact that our city usually ranks fairly high, unfortunately, in numbers of sexually transmitted infections. And that's just one area where I would be interested to see how our city residents feel their needs are being met.
We can send everyone a copy of the draft of the questionnaire, but that is one of the areas that we have on there. I don't want to take everyone's time by reading all these questions, but Linda, we would really love your input and anyone else on this call to the questionnaire since we haven't sent it out yet. We have talked a lot about how we get this to everyone. And, and I'm thinking now with your question, we probably maybe need some outdoor boards or one of the problems is that not everybody is digitally connected. So as Rhonda said, we may even do within wards group meetings, like after church, where we get people to group have the questionnaire administered or helpers to administer it. And then the focus groups after that, or as part of that, would also give us more qualitative data. But we've covered, I think, in the questionnaire, which Matt Haslam, did the draft with the team, with the public information team, and then our committee had a long discussion about it too. I think we've covered some of the things you're asking about. To my mind, the biggest issue is getting good response, and from a range of people in our community, including young people. I don't know if we have any lower age limit, but certainly high school students would be fabulous to get their input from because they are the future as well. So I think one of the reasons we're going to talk with the alders is to get more grassroots assistance, in each ward to make sure that the survey is publicized. It is programmed in Qualtrics, so if you have a computer or a phone, you can participate, but we know a lot of people don't or won't know, won't be aware of it. So those are issues to be worked on. Well, we can send the survey link to everyone after this meeting.
Well, thank you very much. And I certainly would defer to those. I know there are many who maybe even on this call, on our board, or at some of our academic institutions that have vast expertise in getting these surveys completed and incentivizing participation. And it's a whole field. So, but I look forward to seeing it. That would be fabulous. Thank you very much.
Sure. Welcome.
This is one other group that we can utilize is all the primary and secondary school systems. So I meet with their leadership on a weekly basis, and so they can get that information out, at least to their high school students for us.
Great.
I see Sue has her hand up.
Yeah, and maybe I should have asked this question before, but I think it also fits here around the survey. We haven't talked much about environmental health in terms of like our air quality and heat grids and the effect on people's health. And there is more and more emerging evidence, particularly in urban areas, of the disparate effects on people who are living in heat islands and, again, the exposures to particulate matter. And I was trying to pull up the report and it wasn't coming up for me in time, but the American Lung Association State of the Air report, both for 2020 and 2021, has some data in there around St. Louis being in some of, I think it was like the top 25 in particulate matter in the air. And I just wonder if there is a way to start gathering some information about if people understand that effect on health as well. I don't, I think there might be some questions that could be included in the survey that I've seen in other venues that might help. And maybe at some point we could have a report to the board on some of those issues.
There is a question after we give them our, pre-listed wellness areas that we're asking them to vote on. There is an open-ended, is there another wellness area you would add to the list? And also, as Rhonda mentioned, with, the focus groups, that will allow them to tell us in lay language what's aggravating their health conditions. So I think you raise a wonderful, very important point. So I'm really glad we'll send the survey to everyone. So then you need to send us back your comments, and they don't have to be in, survey structure, but just, what issues do we need to address, as you just mentioned, Sue?
I think it's also important to just frame the purpose of the survey as well. So I'm on the communications committee, and one of the things that we talked about was being able to assess whether or not our communication strategy has been effective. So if people are aware of the messages that we already have in place, if there are things that they want to know more about and what their priorities are. So when Lisa mentioned that pre-selected list, that's based on work that's already happening in the health department. And then there's an opportunity for folks to say, this is something that's missing. I think, Susan, to your point about educating people about environmental health issues, the survey may not be the best instrument for that. But if that's something that we want to take up, perhaps we can think about a strategy for a public information or education campaign that addresses that specifically.
I think there's been a lot of discussion about the impact of climate change, and it's very political at this point. And so there's a lot of, like everything else, there's a lot of misinformation circulating. So there's a way that we can provide just really simple information that really explains what climate change is and the evidence behind the evidence that we're seeing in communities, that it actually is real. I think that would resonate really well with our community.
I know Build Missouri Health is a new nonprofit affiliate of the Missouri Foundation for Health, has taken up climate change as an issue that they're interested in doing some initiative or education around. They're not very far along. So if that's something that this group wants to pursue, that might be a connection point as well.
Great.
Thank you.
Any other comments or questions about the survey? All right. The last board committee report is the ad hoc committee participation. We do need to stand up an ad hoc committee based on some of the information we discussed at our last meeting on board governance. So I have a couple volunteers for that. So I will send out an email just to think about the information that Dr. Eccles referred us to, and I think it's the National Association of, I'm perhaps making up the name of city and county boards of health, and they have some information, some trainings, and some information on how to kind of evaluate board functioning and for members to be able to reflect on their role on the board. And so we were going to kind of look through those documents to see what could be useful to this board. And the Delta variant and some other things kind of took precedence, but I will assemble that ad hoc committee. Any other questions or comments regarding any of the standing committees? Okay. Any old business? All right. Any announcements?
Just a couple of health department updates. I'm not sure if we're there yet on the agenda.
We're at that point. We're at yeah, we are there. It's we're on our last agenda item.
All right, so a few updates from the health department. So we have we've selected our new health service manager 2 manager who will oversee the Environment Health Services Division. So that is Mr. Justin Hauser, who's been leading the efforts with our emergency preparedness program for the last 3 years. Prior to that, prior to coming to the city, he worked in Jefferson County, if I'm not mistaken.
Franklin County
Health Department. So previous government experience, and he's been doing a phenomenal job with this at the health department. So I'll be working with him to support him during the this transition. As they mentioned, there are 9 programs under our Environmental Health Services Division. So there's a lot that he has on his plate. So we'll be working with him to make sure he has a smooth transition. We're also working to fill other vacancies in the health department. So for our animal care and control program, We have about 7 vacancies that we've been working with the Department of Personnel to fill. I'm also working with the Department of Personnel to fill our public health program representative positions, which are positions that are responsible for assisting with case investigations related to COVID-19 and other COVID-19 related efforts. And we also have environmental health officer positions, our food safety positions that we're trying to fill. We have, I believe, 2 of those that we're trying to fill at this time. So beyond the personnel front, we also had some really good things that have happened over the past since the board last met. Last Wednesday, the health department, in collaboration with Christian Hospital, announced that they were expanding or implementing opt-out HIV testing for their hospital, their emergency departments at Christian Northeast and Christian Northwest. This was a project that was that started prior to 2019, and so we were happy to see it actually come to fruition. It's a collaboration between the city, Department of Health, Christian Hospital, as well as the state of Missouri and Washington University through the expanded HIV testing program. We've also been, we're continuing to implement the Cure Violence program, oversee the implementation of the Cure Violence program. We have an updated report that I'll share with the board as well, so you all can see the impact of the program, particularly in the catchment areas. We'll also be working to update those reports on a regular basis. And so as we update those reports, we'll share that with the board so you all will be aware of the impact that that program is having in the city of St. Louis. For the report, one of the things we wanted to tease out was what's happening in the catchment area versus what's happening out across the city overall. Because one of the things that we were trying to control as it relates to explaining how the program operates is that it's not covering the entire city. The program doesn't cover the entire city. It only has 3 catchment areas, one in Walnut Park, one in Wells Goodfellow, Hamilton Heights, and the other one is in Dutchtown. So I want to make sure that was very clear. So we were evaluating the implementation of the program in those areas. And we continue to work with Cure Violence Global, Serena, and the Cure Violence Steering Committee, as well as the sites that are actually implementing, or the organization that are implementing the program on our behalf. The health department has been contacted by CDC and NACHO. Last week, a couple of my colleagues reached out to see if the city would be interested in additional opioid funding. So we submitted our application last Friday. So we're hoping to hear back from them. This is only they selected a few cities to participate. City of St. Louis is one of those, and the award may be up to $500,000, and the funds will have to be spent by 2023. And so there'll be some time to spend the funds down. So again, we hope to hear back from them soon, and I'll relay that information to the board. ARPA funds were also released. So this is maybe we can spend more time talking about this during our next board meeting. But the City of St. Louis Department of Health received $15,750,000 through the Board Bill 2, which was passed and signed into law recently. I'll just give you a breakdown, and I'll send this document to you all of the funds. So that $500,000 that was allocated for canvassing and community outreach, $1 million allocated for community health workers, $5 million for behavioral health providers, $5.5 million for community violence intervention programs, $1 million for youth-led programming, $1 million for a mobile vaccination clinic, $1.25 million for COVID-19 vaccine incentive program, and $500,000 for the vaccination education and marketing, so the communication work related to COVID-19. So we'll be working diligently to get RFPs drafted and submitted and posted, so that we can get those funds out into the community as quickly as possible. And the last thing that we have is the mask mandate. So according to House Bill 271, the orders that limit impact businesses can only be in effect for roughly 30 days. And so that 30 days is coming up. As we know, as we prepare for the fall and winter months, we know that we typically see an increase in respiratory illness. And so keeping a mask mandate in place will likely be necessary to protect the health of our community. We know that schools will be implementing a mask mandate over the course of the school year, but we also need to make sure that something is in place community-wide, because a lot of the transmission occurs in our communities outside of the school facilities. And so we'll be, in order for us to extend the mask mandate beyond 30 days, the local governing body has to vote to extend it. And so I'll be working with the mayor's office and providing them with the data to justify the need to extend it. And then we'll go from there. But I keep the board posted and aware of any developments on that end. And then if there's an opportunity for the board to support us in getting the mask mandate extended, I'll let you all know as well.
Thank you, Dr. Eccles. Do we have any questions? All right, any other comments, announcements? Okay, so I think that is our last item of business. Thank you all very much for attending our August meeting. Our next meeting is on Thursday, September 16th at 8 a.m. And we look forward to seeing you then. And I will move to adjourn this meeting.
Second.
Thank you. Any objections to adjourning early?
No.
All right. Have a good day, all.
Thanks.
Thank you, everybody. Thanks, Dr.